Hi, I'm Khwaish. I'm joined by Adam, Jen, and Joaquin, and I'm excited to share what we've been working on with the Data Science Clinic this quarter. We've been working with RAFI, specifically on the Grocery Atlas project. Our mentors on this project have been Dylan Holpern, who's a technical lead at the Open Spatial Lab, and Dr. Kelly Smallenberger, who's a preceptor at the Data Science Institute. Our TA this quarter has been Austin Steinhardt, who's an MS capstone at Harris, and the rest of our team is listed on the slide. RAFI specifically works with policy and advocacy communities to unravel the landscape of inequitable access to food and corporate concentration of grocery markets in the US. We've specifically been focusing on metropolitan statistical areas, which are imaged on the right in the map. MSAs include broad regions, as you can see in the Chicagoland MSA, which includes not only the city of Chicago, but surrounding suburbs. It spans multiple counties and even crosses state lines into Indiana. The reason why we're looking at the MSA level is because state-level analysis is often too broad and masks regional disparities, and county or tract-level analysis is too narrow and misses larger patterns. Using MSA-level analysis allows us to address food insecurity within real economic regions rather than arbitrary administrative boundaries. We're exploring key factors such as market concentration, transportation infrastructure, and population density that influence food access. And as a result, we've been able to create visualizations and analyze key factors affecting grocery stores within MSAs to equip policymakers and community members with actionable insights for improving regional food security. Before we begin any of our own research, we wanted to see what has been done in this space already. And we found that there were several important factors to consider when investigating market concentration and food access. For market concentration specifically, we found that factors relating to income and employment, access to fresh food, health, and transportation were very important. Food access included factors like wealth, distance to grocery stores, and affordability of fresh food.
Throughout our project, we worked mainly with three sources of data. The first was from RAFI, and it was a food access and market concentration score, as well as a few socioeconomic indicators of relevance. We then added the CDC places, which were some 40 health related metrics, and the American Community Survey, which included some around 20 transportation related metrics. Because this was at the census tract level, we had to bring it into the MSA level. So our first step was to create a crosswalk that would bring the tract into a census and the census into an MSA. Once we had that, we could aggregate across the tracts using a population weighted metric for the ones where we had to, or just summing up directly for the ones like total population. And we added the shape files and geographical information for the MSAs, which allowed us to do some geographical analysis.
So our initial exploration consisted of examining the top and bottom scoring MSAs in both food access and market concentration metrics. We then went to map these extreme values to identify potential geographic patterns, the outputs of which you can see here on this slide. The top graph displays the top and bottom 10 MSAs for food access. And we can see that in general, food access is very high within the Northeast, as indicated by these yellowish green colors. And then food access remains very low in the rural Mountain West. Market concentration shows a bit more of a complicated picture, with the top and bottom being a bit more spread out throughout the United States. Overall, we noticed there was a general trend between high market concentration and lower food access. And so after we completed this initial analysis, the next step was to create terciles of our metrics and matching mapping and visualizations. So moving on to our bivariate visualization, which can be seen here. This is a refinement of the map currently available as a part of the Grocery Gap Atlas on the RAFI website, just sort of moved to the MSA level. So a bivariate visualization was requested specifically by RAFI as it was the easiest for their audience to understand. So overall, you can see the picture of food access and market concentration is really complicated and varies significantly across the country. However, there are a few areas that we want to draw your attention to. First of all, we have Florida, which has high market concentration and high food access and is a bit of an outlier in that regard. Second, we want to talk about the Northeast corridor, which has low market concentration and high food access, which is emblematic of the pattern that we've previously seen.
So as part of our analysis of the MSAs, we wanted to see which factors affected market concentration and food access scores the most. This was originally a bit difficult with the nearly 60 factors that we were working with. So our first step was to reduce these using principal component analysis, which allowed us to get it into around 9 to 10 components that affect these scores most. This allowed us to remove some of the noise from a few of the other factors while also keeping relevant information. We saw a few factors that affected both scores greatly, including some health factors such as depression rates, demographic factors such as poverty rates, and commute types such as public transportation rates. You can see here the starred ones are the ones that appear in both factors, around 8 out of 10. RAFI wanted us to explore how a few of the regions of interest stood out with these high market concentration leading to low food access scores and vice versa. We can see how these trends play out in Laredo and the Northeast. We also noticed an outlier in Florida, which exhibited high market concentration scores as well as high food access. Jen, Adam, and Khwaish will speak to each of these through their case studies on the regions.
So I'm going to be talking a little bit more about Laredo, Texas, which is the only MSA in the top 10 market concentration scores and bottom 10 food access scores. So as we can see here on this graph on the left, it's sort of at the extremes, but still emblematic of the larger trends that we've been seeing, which is why we wanted to focus on it. So a little bit more about the current circumstances in Laredo. 60% of Laredo's market share is dominated by HEB, which is a regional Texas grocery chain. And an additional 30% is dominated by Walmart. And just overall, throughout the southern part of Texas, HEB maintains extremely high market share across different MSAs. Laredo also has a very high poverty rate at around 22%, which is twice the national average. And in addition, there's a healthcare worker and resources shortage in the Laredo area. So talking a little bit more about what's most different between Laredo and all the other MSAs, we can see that there are a lot of health metrics and demographics, which is similar to the trends that Joaquin had previously explained nationwide.
Moving over to the Northeast Corridor, which experiences relatively low market concentration yet high food access, we've analyzed these factors in comparison to the rest of the United States compared to this region. And we've seen that there's a higher population density, and this could lend to more food retailers being in close proximity to the population. In addition, there is a well-developed public transit network that can enable easy access to grocery stores. Kind of similar to this, there's a lower vehicle ownership rate, and this can also lead to an increased dependence on small neighborhood stores as well as less car reliance, which can then in turn increase the number of stores required to facilitate the walking to these stores. Last, this region experiences lower rates of social isolation and depression, which is kind of interesting to note.
Lastly, we're examining Florida, which, as mentioned, has both high food access and high market concentration, which makes it quite unusual. As you can see on the graph on the left, which displays Florida's market concentration across the state, we see that higher values on the graph mean that that area is more market concentrated. 46.4% of Florida's market share is dominated by one grocery store chain called Publix, and that can explain the high market concentration that we see. Still, 10.6% of Floridians struggle with access to healthy foods, and if we take a look at some of the factors that are mentioned on the right graph, we see that there's no clear evidence for why food access is so high, but some initial ideas might include less car reliance and more communal computing in the area means that shared commuting is a norm and it allows for more access to food through transportation access and therefore being able to access grocery stores more easily. We also see that Florida has worse heart health metrics, and Florida's median age is higher than the national median age, so residents might be more health conscious and make food choices accordingly. Lastly, Florida has some specific programs like Fresh Access Bucks, which focuses on increasing the SNAP purchasing power for locally produced fresh produce. These are some indications as to why food access is so high in Florida, and further investigation may reveal more interesting factors. And with that, we thank you for your time, and we hope we provided you with some food for thought. We've really enjoyed working on this project this quarter and are excited to continue with this meaningful work next quarter.